Hi, my name is Laylane Chagas. I'm a physiotherapist, and in this video I'll be showing you some tips and exercises and some manual therapy techniques for you to perform foot mobilization or self-massage into the intrinsic muscles of the foot. So if you had a fracture or surgery in your leg, ankle, or foot, you're likely to have a lot of stiffness around the ankle and foot level, mainly if you had to wear a brace or a cast, or if you just wear a specific type of shoes like high heels or hard toe boots that may create some excess tension as well on the foot as well. If you have plantar fasciitis, it's just good practice to keep a good flexibility of all joints, and that may help on managing your pain. So here I'm going to show you the position. So I will show you how to do just a general mobility movement for your ankle, so you can hold your arch with the webbing space of your thumb, and like this or like that. So your thumb is positioned like this, and then you can hold the other part of your hand on your leg. So you can create like a distraction force or a tugging attraction force in there, just to loosen out, and then you may hold in different ways if you like. So you will have to find your own technique, whichever works best for you. So you want to move the ankle in an up and down position and really work on the levels where you feel the most stiffness. And then you can work with the heel on bringing it up and down. So you're going to stabilize the foot by just with your fingers like that, or you can stabilize by holding your foot as a whole. And then we want to be very specific in moving that heel up and down. It just creates some more mobility into the joint in between your heel bone and your tarsal bone there. So up and down, like that. And then for the tarsal bones here, you are just going to work by grabbing your forefoot, so the front part of your foot there, and you can do a little bit of a twist as if you're trying to open the arch and close the arch. Open and close. That may be a little bit sore for the ankle, so you may want to fixate your heel, not let it go anywhere while you do the movement, and that can create a better torque of movement into that zone, the tarsal joints of your foot. So you keep twisting out and in while you stabilize the heel. So just movements there. And it's very non-specific movements. You don't need to be very careful. If you had surgery more than 3 months ago and you're out of the cast, it means that your bones are healed. So just remember that we jump on our foot with all our weight. So not just because you have pain, that just means that tissues around your joints and tissues are just sensitive. But remember that you won't do any damage by doing movements with your hand. Just remember you jump on your feet with your body weight. And if you are in doubt, if you have a recent injury, it's always good to check with your therapist on what you can and cannot do. So if there is no recent trauma, you are welcome to try to just get some grease into those joints of the foot. And then you can work on the metatarsal, the bones that goes along there. So you have 5 metatarsal, 1 for each toe. And what you can do is just to get the first and the second and just try to do a shear force. Just a shear force like this. And there. And then you go to second and third. Third and fourth. You can see there the movement. So I'm doing this movement with my metatarsals, or the bones, the long bones here in the foot. And the fourth and the fifth. And it can go more towards the middle of the foot And any area that you feel is stiff, work a little bit harder there or longer. For the toes, you want them to be able to flex. Oh, you just heard a lot of clicking there. Clicking is normal. Clicking means joints are stiff and out. And as you keep moving, the clicking loses power or disappears. So out and in. You can do as a whole, the 5 toes at once, or you may work with one at a time, depending where your injury was. Again, it will be good for you to just get the proximal part of the toe there, close to the foot, and then just tug, trying to separate the toe. Separate, and then you just wiggle side to side. Separate, wiggle. That can have a loosening effect into the joint, especially if you have a bunion or tightness. And depending how much pain you have, will determine how graceful you are doing the movement, how gentle you are. Okay, so slow, steady, and just work on that mobility. You may want to do the same movement for the toes by just putting your foot on the ground and leaning on your toes like this or like that. And letting it mobilize. So we worked with the ankle, we worked with the heel joint, we worked with the tarsal, metatarsals, and the toes there. For the soft tissue muscles, tendon and so on, you would just mobilize the tissues on the top of your foot or ankle area if you have a scar tissue. And in that way, as you can see, I have a scar tissue here that's well healed a long time ago, but you want to do a good mobilization there. You want to make sure that scar tissue is well moving in all directions, so you can go up and down, side to side. You may want to go in diagonals. So if that was recent, obviously the amount of pressure I can put is not going to be great because that will be very sensitive. But if you are a month away from your surgery, it's safe for you to be mobilizing because it means your scar tissue is healed. So just ask your surgeon for opinion on how soon you can start the mobilizations, even if you didn't have any complications like infection as well, or whipping of the wound. So that will determine how soon you can or how late you can start the mobilization. So in that area, you don't have muscles going on, it's mainly tendons and ligaments. So the only thing you can do in terms of soft tissue is scar tissue mobilization. So you want to see the scar tissue that's well mobile. Because if you don't have a mobile scar tissue, every time you move, you may feel a tugging sensation, a pain that may impair on your ability to accept movement in that zone. In the bottom of the foot, there's a lot you can do, especially because there is a lot of intrinsic muscles in the sole of your foot. So it's good practice just to go on just rubbing with the thumb or with the knuckles or with the heel of your hand there. Just rubbing on the areas. You can roll a ball, you can just rock your foot on top of a tin can as well. That can act as a self-massage. And then if you have plantar fasciitis, if you have pain in the arch, in the superficial part of your arch there, you can hold your heel to stabilize it, and you may want to stretch your foot towards opening the arch. So it's like if you're doing this movement with the arch and the toes out. So that can have a windlass effect of that plantar fascia and the tendons that goes on, and be a very nice stretch for that area. So these are just tips of mobilizations and soft tissue massage that you can have for your foot.